The top stories tonight in Y News. The Department of Trade and Industry expects more jobs as the National Capital Region transitions to Alert Level 3.
Minor outpatients now included in COVID-19 vaccination priority.
The Philippine Hospital Association questioned PhilHealth's capacity to pay their obligations to various healthcare providers. The Philippine Statistics Authority aims to launch a mobile version of the national identification.
A new advisory group team was formed by the World Health Organization to investigate and find the origin of COVID-19.
Canadian actor William Shatner is now the oldest person ever to fly in space. Good evening, Philippines and the world. We are now reporting live from Quezon City. Today is Thursday, October 14, 2021. I'm Herlene Delgado.
Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Teo.
First in the news. World Health Organization cautions the public amid lower COVID-19 alert level in the National Capital Region. Meanwhile, the WHO official also recommends the provision of third vaccine shot for the immunocompromised and the elderly population. Rosalie Cons will tell us why.
World Health Organization Country Representative Dr. Rabindra Abeya Singhe supports the decision of the government to downgrade the COVID-19 alert level of Metro Manila to Level 3 due to high vaccination rate. But Dr. Abeya Singhe said it is best to exercise precautionary measures, especially there is still the threat of COVID-19 variants.
We support the easing of restrictions because broad lockdowns have terrible economic consequences and affect the people negatively. So we are supportive of this, but we need to be very careful. That's why I said we need to calibrate our response.
Abeya Singhe stressed the importance of accessibility of COVID-19 tests through the local government units, immediate quarantine and isolation of those with COVID-19 symptoms, and imposition of granular lockdowns in specific areas if necessary. Meanwhile, the WHO also supports the provision of third COVID-19 vaccine dose for people with immunocompromised conditions and the elderly population.
In addition to immunocompromised individuals, that we include all individuals who have received a primary vaccination course of 2 doses with Sinovac or Sinopharm to receive a third dose, provided it's more than 3 months since the completion of their first 2 doses.
However, Abeya Singhe clarified WHO does not recommend third dose for the general population. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Trade and Industry is optimistic that more jobs are expected to return in the labor market as Metro Manila shifts to Alert Level 3. Secretary Ramon Lopez said with most of the remaining economic sectors are to be reopened, they anticipate 300,000 displaced workers to be back to work. The DTI chief, however, said the job numbers are not yet back to pre-pandemic level as business establishments are not yet operating at full capacity.
Meanwhile, the government increases the venue capacity of establishments' operations in Metro Manila as it shifts to Alert Level 3. But the business sector explains that they need 70 to 80% operational capacity to recover from losses. Asher Kadapan Jr. tells us why live. Yes, Asher, good evening. Go ahead.
Good evening, Will. Some business establishments, especially those that provide service, maintains a fixed cost of expenses as well as a fixed salary rate for employees to run their operation. Federation of Filipino Chinese Chambers of Commerce and Industry Incorporated President Henry Lim Bon Leong explains this as they urge the government to finally allow 100% venue capacity, at least for fully vaccinated citizens.
Whether if you give them 30%, 50%, yung expenses sila ganun pa rin. So give them up to 70 to 80% para at least makabawi naman sila. Kung hindi, talaga hindi makabawi yun, as I tell you. Bubuksan lang sila, break even lang, salamat na sa kanila.
Based on the updated guidelines issued by the Interagency Task Force for the Management of Emerging Infectious Diseases, the Alert Level 3 has allowed 30% indoor capacity, but only for fully vaccinated customers, while outdoor capacity is at 50% regardless of vaccine status. An additional 10% capacity will be allowed if the establishments have been awarded Safety Seal certificates. While establishment located in areas with vaccination coverage above 70% for both Priority Group A2 or senior citizens and Priority Group A3 or adults with comorbidities as determined by the vaccine cluster of the National Task Force Against COVID-19 will be allowed 20% more in its venue capacity. Hence, an establishment may allow a maximum venue or seating capacity of up to 60%. But Philippine Chamber of Commerce and Industry President Benedicto Yuico said in a statement that why not allow business operations to allow with full capacity if both the employees and clients are fully vaccinated against COVID-19. Resto PH, a group of restaurant owners, and the Federation of Filipino Chinese Chambers of Commerce and Industry Incorporated also urged the government to allow full capacity of business operations.
Even at 50%, kulang po yun. So, kailangan pa talaga namin madagdagan if possible. So, I think asking for additional capacity is reasonable under the circumstances. And for the restaurant industry, it's already vital because pilay na po kami ng napakatagal na panahon.
Alam mo, negosyo, mga negosyante, sa Pasko talaga itong bumabawi. Kaya, baka lumampas itong Pasko na ito, wala na naman, So hopefully, that's really open it up as soon as possible. And I hope that the IATF and the president also hit to the demands of the entrepreneurs sa mga negosyante.
Will the business sectors further explain that allowing full capacity in their business operations will significantly help them pay their employees with their 30-month pay? Will.
Yes, thank you, Asher Kadapan Jr., for that live report. A number of areas in the National Capital Region under granular lockdown has declined further as of Wednesday. Based on the data from the Philippine National Police, from 121, it is now down to 117. On the other hand, a total of 292,442 quarantine protocol violators have been recorded in the National Capital Region since the implementation of Alert Level 4. Meanwhile, Malacanang said there is no conclusion yet on whether the COVID-19 alert level system is more effective than the community quarantine system.
The Philippines' nationwide tally of COVID-19 infections rose to 2,698,232 after the Department of Health, or DOH, reported additional 7,835 cases today. In its bulletin, the DOH said that the latest figure raised the country's active cases to 84,850. Of this number, 77.2% are mild, 10.6% are symptomatic, 7.01% are moderate, 3.6% have severe symptoms, and 1.5% are in critical condition. Total recoveries climbed to 2,573,161 after 8,268 more patients survived from the disease. The DOH also reported 154 new fatalities, pushing the death toll to 40,221. Meanwhile, the overall global COVID-19 caseload has reached to 239,208,897, while the deaths have surged to 4,875,011, according to the Johns Hopkins University. The U.S. is still the worst hit country with the highest number of cases and deaths at 44,683,145 and 719,530 respectively, according to the CSSE, followed by India and Brazil. All is set for the pilot inoculation of minors against COVID-19 tomorrow. Aside from children with comorbidities and confined in participating hospitals, outpatients are now included in the priority list. Aiko Miguel details why.
The Department of Health targets to inoculate as many minors as they could so that children can already be protected against COVID-19. DOH National Capital Region Director Dr. Gloria Balboa said this is the reason why they already included minor outpatients in the priority list. These children are the ones who have a medical record in the hospital. This way, it will be easier for doctors to monitor their condition even after their inoculation.
We really have to be very careful kasi hindi pa natin alam kung ano magiging effect nun talaga, no, ng sakuna with them, with the different comorbidities na meron sila.
Meanwhile, the remaining of the minor population belonging to the 12 to 17 age group will be included in the second week of the rollout. In a statement, Health spokesperson Undersecretary Maria Rosario Vergeres said the vaccination among the pediatric A3 sector is being rolled out through a phased approach in order to adequately monitor the vaccine recipients. More than 1,000 doses of COVID-19 vaccines have already been delivered in 2 participating hospitals yesterday. The DOH NCR also conducted simulation exercise yesterday and today in the 8 participating hospitals to check hospitals' preparedness. Parents or guardian of pediatric A3 category are reminded to secure a medical certification duly signed by their attending physician or pediatrician. They must also have documents to prove filiation of guardian to the vaccinee. Each hospital target to inoculate 50 children a day. In the Philippines, 12.7 million minors aged 12 to 17 with comorbidities are eligible for the pediatric vaccination against COVID-19. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippine Hospital Association questioned Philippine Health Insurance Corporation's capacity to pay their obligations to various healthcare providers. Nel Maribuhok will tell us why.
Philippine Hospital Association President Dr. Jaime Almora revealed during the House hearing that some of the largest hospitals in the National Capital Region have already received payments from PhilHealth. But the question remains on why the state health insurance is taking so long to reimburse other claims. In Cordillera Administrative Region, Region 1 and 2, there's about 489.8 million pesos unpaid COVID-19 claims from January 2020 to September 2021.
There was some progress in the payment to big hospitals in NCR and bubble areas, but they claimed that the payment was too small. The noise of anguish grew and there was anger in the air, fueled by the retroactive non-payment of probable COVID claims that were result to massive losses of hospitals. And my question is, how the questions that we have to answer, because this is the questions that are really being asked, is the poor payment due to lack of money of PhilHealth, or is it due to fear of the personnel to process the payments? That is the question.
PhilHealth President and CEO Attorney Dante Gueran assured they have enough money to pay their obligations and they are now working on ways to fast-track the process.
Congress is here to give us, to appropriate for us money. What's the use of our very good Congress? So Congress is here. We are also considering engaging IT service providers that will assist us in maintaining an automated system to process claims of hospitals within the required period.
Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
And in other news, the government is ready to help businesses so they can provide 13th month pay to their employees. Janice Inhente will tell us why.
No company is exempt from providing 13th month pay to their employees. This is in spite of the crisis caused by COVID-19. According to presidential spokesperson Harry Roque, the government is ready to support businesses so that they can release the benefit in time.
Dahil alam natin na maraming mga small and medium scale industries na nahihirapan nga po dahil nag-lockdown na naman tayo, no? Magbibigay naman po ng assistance ang ating gobyerno sa pamamagitan ng Small Business Corporation, no? Para dun sa mga small and medium scale industries na kinakailangan ng tulong pambayad sa 13-month pay.
Meanwhile, the Department of Labor and Employment is already in talks with the Department of Trade and Industry and Employers Confederation of the Philippines to form a loan facility.
Very positive ang reaction ni President Jun Luis. Sabi niya, makikipag-usap sa kay Secretary Lopez, and probably we will also involve Secretary Dominguez of the Department of Finance because this involves loan facilities.
Under the program, micro, small, and medium businesses can borrow 50,000 to 200,000 pesos for the 13th month pay of the workers. The loan is zero interest and can be paid within 1 year. Janice Gente, UNTV, News and Rescue. We serve the people, we give glory to God.
The Philippine Statistics Authority aims to launch early next year a mobile version of national identification. JP Nunez will tell us why.
For an easy access of national ID under Philippine Identification System, the Philippine Statistics Authority are now discussing preparations to launch mobile national ID. With this program, registered applicants with approved national ID may access theirs through mobile application which may be downloaded through App Store or Google Play. The agency aims to launch this system early next year.
So ito yung isang proyekto that the PSA is working on, and we hope to be able to launch it very soon. Ang target namin is early next year. Early next year ay meron na tayo ditong mobile ID.
Meanwhile, the registration for the national ID in the country continues. Based on the latest data, 43.2 million Filipinos are now registered for the first step of PhilSys. 34 million submitted their requirements and biometrics for the step 2, while 2.2 million received their printed cards. The agency aims to register at least 50 to 70 million Filipinos by the end of 2021. As more Filipinos register online, the PSA reminded the public to be vigilant against fixers and hackers to avoid identity fraud.
Kasi magsasubmit sila ng information. So, importante na nandun sila sa tamang website. Kailangan nilang ingatan ito dahil lalo na kung naglalagay sila o tinatanong sila ng mga impormasyon. At alam naman natin na pwede silang mapunta sa identity fraud, manakaw ang kanilang pagkakilanlan at ang kanilang pagkatao dahil lang nagbigay sila ng information sa maling authority.
The official website for the national ID registration may be accessed only through www.register.philsys.gov.ph. JP Nunez, UNTV, News and Rescue. We serve the people, we give glory to God.
Vice President Leni Robredo is still hopeful for a unified slate, not among the presidential bets, but among other individuals in various political parties. But for another presidential aspirant, Senator Panfilo Lacson, a real unification was not the objective of the unity talks. Here's the report. The senatorial slate under the ticket of Vice President Leni Robredo and Senator Leni-Kiko has been finalized according to VP Robredo herself. She declined to reveal the names for the meantime, but noted that they came from various political parties, 3 of whom are from political party.
We are very hopeful that unity is still possible, maybe not among the presidential contenders, but definitely among many different kinds of people from different political affiliations. We have been pushing for inclusivity, and we have already started doing this after I filed by reaching out and talking to those who are not members of the party. from the start, our goal has always been to forge the broadest unity possible.
But for another presidential aspirant, Senator Panfilo Lacson, the unity talks have failed because it was quote-unquote a scheme. In a media forum, Lacson recalled their second meeting with the vice president where he felt insulted about an alleged plan of a Robredo-Soto tandem.
Si Senator Drilon mismo, tinuro niya si Vice President Leni saka si Senate President Tito Soto na sila yung magka-tandem. In my face, it's good that I did not notice it. I was only informed by the Senate President after our meeting. Sabi niya, hindi mo ba napansin na yung dalawang daliri ni Frank nakaturo sa amin dalawa? Parang effectively telling me in my face to withdraw and mag-create ng bagong tandem between the Vice President and the Senate President. So sa akin, when I was told that, I felt insulted,
The UNTV News is trying to get a comment from Senator Drilon on the issue. According to Lacson's running mate, Senate President Vicente Soto III, it was too late for any unity talks, even at the time, as they have already organized their alliances across the country. The Lacson-Soto tandem may endorse a senatorial slate composed of not 12 but 14 senatorial bets. Included in the initial list are Sorsogon Governor Francis Cheese Escudero, House Deputy Speaker and Antica Representative Loren Legarda, Senators Juan Miguel Zubiri, Sherwin Gatchalian, Joel Villanueva, Richard Gordon, former Senator J.V. Ejercito, former Makati Representative Monsur del Rosario, Dr. Mingita Padilla, former Agriculture Secretary Manny Piñol, DICT Secretary Gringo Honasan, former Vice President Jejomar Binay, and media practitioner Paulo Capino. A surprise candidate is also expected. Lacson says they have yet to reveal the final names as substitution is still allowed until November 15. Harleen Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
Defense Secretary Delfin Lorenzana led the turnover and acceptance of the 5 S-70I Black Hawks and 4 Scan Eagle unmanned aerial systems at Clark Air Base, Pampanga. Lorenzana said these additional assets are seen as crucial in keeping communities and people safe from traditional security threats and disasters. Lorenzana adds that the additional 4 long-endurance, low-altitude Scan Eagle unmanned aerial vehicle will enhance the AFP's surveillance capability, while the Philippine Air Force can now provide prompt and sustained day and night tactical heli lift and combat search and rescue operations with the 5 more Black Hawks. 10 UH-1D helicopters, which were acquired in 2013, were also decommissioned during the event. The government will try to resolve unpaid salaries of overseas Filipino workers in Saudi Arabia. According to Malacanang, they will try to negotiate before it resorts to a proposed deployment ban. Presidential spokesperson Harry Roque said Labor Secretary Silvestre Bello III will head to the Middle East later this month to discuss the issue with his Saudi counterparts.
And for the news abroad, a new advisory group team was formed by the World Health Organization to investigate and find out about the origin of COVID-19. RK Llorca will tell us why live. Yes, RK, please go ahead.
Yes, Mariel. World Health Organization Director General Tedros Adhanom Ghebreyesus believes it is important to understand the origin of the new pathogens to avoid future outbreaks that have epidemic and pandemic potential. The new advisory group is formed by 26 proposed members of Scientific Advisory Group on the Origins of Novel Pathogens, or SAGO.
Following the last mission to China, there were more than 36 recommended studies that needed to be carried out. We hope to get an update on those studies as well, so that we can say, okay, here's what's next. So this advisory group will provide advice to WHO on those urgent next steps, and then WHO will work with any member state, including China, to carry out what needs to be done. But really, I think there's no time to waste in this.
WHO top emergency expert Dr. Michael Ryan stated that the new panel may be the last and best chance to achieving clarity on the origin of the virus. China's ambassador to the UN believes otherwise and said it is time to send the team to other countries and that the basis should be science and not intelligence agencies. Attempts to investigate COVID-19 origin held in Wuhan has failed to deliver its desired outcome, reportedly due to lack of data. Mariel, meanwhile, in Brazil, President Jair Bolsonaro continues to reject his needs for COVID-19 vaccine, claiming that his antibodies are high enough and does not need a jab. Brazil, to date, has recorded more than 600,000 deaths related to COVID-19. Back to you, Mariel.
Thank you, RK Yorka, for that live report. Aid agencies provided humanitarian assistance to displaced families in Kabul. Maeve and Dog will tell us why live. Yes, Maeve, good evening.
Good evening, Marielle. Chilly weather underlined the urgency in getting assistance to thousands of displaced people in Kabul. 324 families received food, blankets, and cash to help combat the cold season. This is just a small fraction of about 50,000 displaced Afghan people who are needing urgent assistance, according to United Nations High Commissioner for Refugees spokesperson Babar Baloch. Many people fled from the violence in their provinces and are now sleeping at makeshift shelters in the capital. Poverty has extended into cities due to widespread unemployment and withdrawal of Western support, which forced the many to try selling their household goods. Meanwhile, the group of 20 major economies pledged to provide humanitarian assistance to the country, along with the United States separately promising to help relieve the hardship faced by millions of Afghans. Marielle?
Maeve, are there any data suggesting what could the following months look like for the country?
Yes, Marielle. The cold season lasts for 3 months, so that's from December to March, with January being the coldest and with possible peaks of -20 or -25 degrees Celsius. UN estimates suggest that in a worst-case scenario, as much as 97% of the country's population could be plunged into poverty by next year. Back to you, Marielle.
Thank you, Maeve and Dog, reporting live. The Australian Competition and Consumer Commission, or ACCC, released a warning on a message claiming to be from the Australian Border Force. The recorded scam message informs the target of a warrant of arrest issued under their name for an illegal parcel that has been allegedly intercepted. The target is then asked to dial 1 to speak to an officer, where they will start to ask about personal information, including bank account details. Other methods that scammers use include dating websites, fake charities, investments, and job employment opportunities. A spokesperson from ACCC made it clear that law enforcement agencies and government departments' protocol would be to issue either an infringement notice or fine. It is always advised to verify the matter with a concerned government organization directly before giving out personal information. Canadian actor William Shatner is now the oldest person ever to fly in space. Paul Gatchalian details why live. Yes, Paul, good evening.
Marielle, 90-year-old William Shatner, famed for his Captain Kirk role in the Star Trek film series, sets a new record as the oldest man to fly in space. He upstaged the 82-year-old Wally Funk, who was a former astronaut trainee. The actor blasted off on board the New Shepard, developed by Blue Origin and founded by billionaire Jeff Bezos, who is a lifelong Star Trek fan. Bezos flew Shatner as a comp guest along with Blue Origin's Vice President of Mission and Flight Operations and 2 other crewmates who are paying customers. The trip did not go exactly as how Shatner captained during his acting career, but he described the short space flight that lasted for only 10 minutes as the most profound experience.
What you have given me is the most profound experience I can imagine. I'm so filled with emotion about what just happened. It's extraordinary, extraordinary. I hope I never recover from this. I hope that I can maintain what I feel now.
Shatner's flight marked the second successful space tourism flight operated by Blue Origin. The first one was Jeff Bezos himself, who flew to space in July, demonstrating his trust in the safety of the technology of his rocket company. Back to you, Mariel.
Thank you, Paul Gatchalian, for that live report. And those are the reasons behind the news in other parts of the globe. I am Maria Latoza, reporting live from Perth, Australia. Good evening.
And before we close, we will leave you with a word, giving glory to God. From the book of Psalms, chapter 138, verse 6, it says, "Though the Lord be high, yet hath he respect unto the lowly, but the proud he knoweth afar off." And those are the reasons behind the news, October 14, 2021. I'm Herlene Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.
And my question is, how the questions that we have to answer, because this is the questions that they're really being asked, is it the poor payment due to lack of money of PhilHealth, or is it due to fear of the personnel to process the payments? That is the question.
Congress is here to give us, to appropriate for us money. What's the use of our very good Congress? So Congress is here.
Even at 50%, kulang po yun eh. So, kailangan pa talaga namin madagdagan if possible.
Alam mo, negosyo, mga negosyante, sa Pasko talaga itong bumabawi. Kaya, baka lumampas na itong Pasko na ito, wala na naman, ano. So, hopefully, that us really, open it up as soon as possible.